Welcome, everybody. I think you can probably hear me. Really happy for you to have your cameras on or cameras off, totally up to you. And there will be an option to ask questions at the end. And obviously this will be saved. It will be recorded and saved and sent to you if you have signed up, obviously. Right. Hi, welcome everybody that's joining. We're going to give it a couple more minutes just to let a few people come on in. And then we'll get cracking. Welcome, welcome. Okay. Right. Welcome everybody. It's 7:30. I'll give it maybe one more minute and then we will get cracking. Okay. Let's go. So welcome to a Men in Menopause webinar, which I'm really excited to bring to you on a very cold Sunday evening. So if you're catching up, welcome as well. I want to extend my thanks to Dr. Vikram Talaulikar, who is with me. You can see him there, my left, who is a British Menopause Society doctor. He is an associate specialist of a reproductive medicine unit at University College London Hospital's NHS Foundation Trust and an honorary associate professor at University College London. He has a special interest in women's health and in particular menopause. And at the moment, he is everywhere trying to raise as much awareness as possible. And so I'm really, really, really grateful for his time this evening to have what is a really, really important conversation and allowing men to come on in and support any women in their lives. So Vikram, welcome. Thank you for joining.
Thank you. Thank you, Kate, for having this. Not many sessions are done specifically for men. And not many men join sessions when we have them for women. So this is really crucial, important piece of dialogue. Thank you for the invite.
No, thank you. I think the best place probably for us to start, just in case anyone isn't aware, is what is menopause? I'm going to hand the floor over to you because you will give a much better medical description than I will. So yeah, Vikram.
Okay, so let me give the medical bit. And then I'm sure we're all wanting to know your story, Kate. That's equally important. So I guess medically, we say someone has gone through menopause, or a woman or an individual has gone through menopause when they stop having their periods for more than 12 months. And that's a technical definition. To draw a line as at what point do we say somebody has attained menopause? Is that when they've stopped their periods for 12 months or more? But as simple as it seems, biology is never so simple. So always there will be lots of sort of nuances to this, is that the bleeding may not always be regular before the 12 months of stopping of periods. The symptoms may happen much earlier. So we often say there are three phases: the perimenopause, then the menopause, and finally the post-menopause, which all form part of the menopause transition. So perimenopause would be the first stage. Most women who would be having a relatively regular periods or regular menstrual cycles, they would start experiencing some changes to their periods. maybe frequent periods or gaps between periods. And for majority, that will happen somewhere between 40 to 50 for 3 to 5 years. That's perimenopause. At this point, the hormones are changing. Usually estrogen and progesterone are dropping. The FSH is going high, and it's all over the place. So the hormones are really fluctuating quite a bit. And some symptoms will happen. So women will note things like hot flushes, sweats, or fatigue, or mood changes, psychological changes. Some of those symptoms will start appearing a little bit for many women at this point. Then comes the menopause. So as we said, the periods become so wide apart, there's gap, 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 and eventually for 12 months, there will be no more periods. That is when technically you've gone through menopause. At this point, the ovaries are making very little hormone, very little estrogen, no progesterone, and the testosterone is also slowly coming down. And finally, any time from that 12 months of the last period till end of life, so that's 10, 20, 30, 40, 50 years of a woman's life, all that is post-menopause. And so there's plenty of years where one has to look after the quality of life and the long-term health. Can't hear you, Kate. I think you're on mute.
I think it's so confusing because, as you say, you've got this age gap of perimenopause or this time of transition, which is when a lot of women don't actually realize that they're in perimenopause. And I think that is that's the biggest problem that a lot of people are facing at the moment, is that women aren't aware of that, their partners aren't aware of that, and it literally hits them from nowhere. And as much as the education, the conversations are there, I am still shocked, as I'm sure you are, the amount of women who are undiagnosed or have no idea what's happening to them. And I'll touch a little bit on that just because I think it's fair to share my story briefly, in the hope that it helps other men understand what their wives or their partners might be experiencing. So I was around about 41. And I would say my first symptoms were my periods started to become every sort of 21 days. Then suddenly it was sort of, 40 days. There was just no rhyme or reason. I couldn't track them. I didn't really know what was going on with them. And, kind of that was that. Didn't really think much of it. It was just annoying. Then that was often coupled with really terrible t-shirt changing night sweats, like proper like embarrassing night sweats that didn't make me feel overly confident. And obviously with those night sweats, my sleep was massively impacted. So I became very agitated, very, not pleasant to live with, maybe, if I say that now in hindsight. And then crippling joint aches and pains, breathlessness, heart palpitations. And I suppose at 41, menopause was so not on my radar. And I think that again is the thing. I was talking to friends who were older than me, and they were like, "You're too young. It's not menopause." Anyway, so all these thoughts are going through my head of what it might be. So then I think there's this real fear in women as well, which exacerbates those symptoms because you think it's something worse than perimenopause. I reached out to my GP. Similar story again to a lot of women, was diagnosed with depression. We were coming into lockdown. It was, it was a really difficult time for the NHS as it was. And then I guess trying to cut a long story short, I had one of the things that, again, many women face. My dad was very ill and was diagnosed with cancer, and I became one of his primary carers. So I had young children, I had a sick father, and I was experiencing these really debilitating symptoms. And I guess, as this is a Men in Menopause webinar, it's really important to say that had a massive impact on my relationship with my husband. It had a massive impact on my relationship with my children. I was really angry. And I was probably really difficult to live with. I probably still am, to be fair. But I was even worse back then. So I eventually got an appointment. I went privately, which I think is the narrative of many women. They're not getting necessarily the help. And I was privileged enough to be able to do that. And I got my HRT, and I know we'll come on to that because it will be worth explaining that journey. And it wasn't the silver bullet for me. So it wasn't until I started making other lifestyle choices and changes that I began to feel better. But what I want everybody to know that's watching this is that really can happen. Like whatever stage you are in supporting somebody, and you feel really lost and you feel, you know, that you can't help them, be an ear to listen, I guess, for now, but just know that you will get your partner back. It is possible. So I guess, Vikram, I've talked about like some of the symptoms that I've had. There are a lot of symptoms of menopause. So let's go there with a little bit of how, when those hormones are fluctuating, why those symptoms occur. Yeah, how that, obviously I've gone into that, but how that can affect women, and I think different ethnicities as well. It's really important to touch on that, so that we can paint a really big picture of anyone who's watching this.
So I think the symptoms are very different for different individuals. So one thing to say is menopause is not the same for everyone. And in fact, we've been talking about natural menopause. It will be very different for, say, individuals who have surgical menopause. They have to have an operation to remove their ovaries. They're in menopause overnight. Within 48 hours, they have no hormones. Medically induced menopause for cancer treatments or for endometriosis. Again, those will be very different to somebody going through a natural menopause. But let's concentrate first on the majority, which is the natural menopause, which happens after 45. So most women in the Western world, on an average, will have menopause around 51 or 50, 51. That's the age. But the wide range is between 45 to 55. So you've got 10 years where women will slowly stop their hormones and then go through the menopause. If they go through menopause between 40 to 45, then that's going to be early menopause. And about 10% of women will have early menopause. And if they go through menopause below the age of 40, then that's premature menopause, also technically called as premature ovarian insufficiency. So that's only 1 to 2% of women will stop periods before the age of 40 and go through a premature menopause. Symptoms may just last a few months. For lucky individuals, it may be few months or a few years, 2, 3 years, and they may not be very horrible. So few symptoms, mild flushes, sweats, they can cope with, not much impact on their mood or psychology. But for others, it can be horrendous. So there can be debilitating symptoms from head to toe. And it's thought that about 80% women have some or other symptoms, out of which 30% have severe debilitating symptoms. So that's quite a lot of women going through a difficult transition when the hormones start dropping. Now, why symptoms happen? We know estrogen levels drop. Ovaries produce estrogen, ovaries produce testosterone. Part of it, 50% of the testosterone, they also produce progesterone. Now, once the menopause happens, there is no more egg activity happening in those ovaries. So they don't produce enough estrogen. It keeps coming down, 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 and stops. There's no progesterone happening because no egg activity happening. And the testosterone is coming down right from, say, 30s, 40s, slowly declining. And that triggers all the symptoms across from head to toe. So there are more than 30 symptoms, some of which you talked about already. But it could be the headaches. It could be the new onset migraines. It could be the sensation of the heat, the flushing, which sort of ends with chilled sensations or cold sensation. Sweats, night sweats or day sweats can be problematic. Sleep is affected. So not just because of the flushes, but even if the woman is not having hot flushes, quality of sleep goes down significantly. So there'll be awakening at night, disturbed sleep. And you can imagine if we don't get one night's sleep, the next day is horrible. But if that happens again and again, then that's really destroying your quality of life, your work environment. So the lack of sleep then causes fatigue, and then the fatigue will impact the mood. Even otherwise, the lack of estrogen is terrible for the mood for many women. It's the first time they may have depressive symptoms. First time they have a lot of heightened anxiety, palpitations. And then you have joint pains, physical muscle aches, joint aches, bone pains. You can have vaginal dryness, pain during sex. You can have bladder urgency, so you have to go to the loo more often during night or during day. Incontinence, leakage, something that people don't talk about because of embarrassment. All those symptoms from head to toe, and I've just mentioned the really big ones, but there are many others: itching, pruritus, scalding sensation, allergies, intolerance to food or many other substances. So much to go through, 30 odd symptoms. I think that's really difficult when the transition becomes difficult.
Yeah, thank you for that. Because I was going to say, I think that that's really important. One of the things that you picked up there is the genitourinary symptoms, the UTIs, vaginal dryness, because obviously, again, that has a massive impact on relationships. And I think that that is, often men might think that women are withdrawing because they don't love them anymore. They don't want that intimate relationship. And that sometimes couldn't be further from the truth, is that they're embarrassed and they don't know how to have those conversations. And I think that hopefully we can send this round to people that signed up, for people here today, and break down some of those more taboo barriers, and have those conversations, because menopause is a natural stage in a woman's life, and there is no shame in it. And I think that that's the message we need, and that it can be a positive experience if we get the support that we need at home and in the workplace. Really critical. So, I mean, let's go there with what would you say a partner could do to support someone?
There are many things here. So as you rightly pointed out, it's simply, if you are a human being, there's the natural caring attitude that all of us have. We want to see the best in our family, in our friends. We want to really care for them, make them feel better. So I think there are many sort of practical points or tips one can discuss to help your partner who may be going through a difficult menopause transition. So the first I would say is to educate yourself and learn what happens during menopause. Now, I work in the menopause area. That's my profession. So for me, I will know what happens. But whenever I see partners attending with their partners in the clinic, whenever I see men joining some of the sessions we do, uh, it's again the same theme emerges, is that we haven't really done good job so far in educating men, educating partners about what menopause is. In fact, women complained that they haven't been really taught about menopause right from the school age until later life. So you can imagine, if women are saying this, that we've actually underserved generations of women, not telling them what to expect in menopause. Men still far away. So really the first thing to do is, if you think your partner is going through menopause transition, you want to help, the first thing you want to know is arm yourself with the education. There are lots of good sort of avenues out there. Kate, your book is there. There are other books. I think Nikki Woods has done a book, Partner's Guide for Menopause. There are also NHS resources, Inform NHS, very good resource for partners, many others, and we can hopefully signpost people at the end of the session. But if you know what to expect, what symptoms they might be going through, what really may be happening to their background hormones, what may be the physical, the psychological aspects of this, and what could be done to improve that. Is it lifestyle? Is it non-hormonal treatments? Is it HRT? Should they be actually taking medicines? Even if you have a basic knowledge of this, you will definitely itself acknowledge their symptom. And one of the things you can best do is really acknowledge somebody's problems. In the clinic, as long as you get people to talk and say, actually, the fact that I've spoken to you, I have these symptoms, and you acknowledge that these are because of hormone changes, you can see the big difference it makes for that person. So the one thing is education, learning what symptoms to look for. You're on mute, Kate.
Going to interrupt you briefly there, just to say, just in case anyone doesn't know, should we just quickly clarify what HRT is?
Okay, so HRT is hormone replacement therapy. So if you want to treat menopausal symptoms, if they're not very severe, not debilitating, they can be addressed with lifestyle, can be addressed with non-hormonal therapies or treatments. But if they are impacting quality of life, then there's no need to suffer. You can consider replacing estrogen, replacing progesterone or progestogen, and in some women also testosterone. That is what we call hormone replacement therapy. And that is a gold standard treatment if you have difficult symptoms.
Thank you. I just thought we should clear that up. So yeah, so coming back to how one can support the partner. One suggestion I had as well from someone, I did actually a podcast with lovely Darren and Anna Goff. And Darren said he would send Anna podcasts that talked about menopause and talked about symptoms, and equally she might listen to something and then send it to him, because actually sometimes it's harder for the woman if you know you are going through all of this to have those conversations. And if someone's on the road or they're driving or they're traveling, you know, I think it's really important to say that sometimes there's never the right opportunity, because we have such busy lives. And you know, a lot of women going through this life stage, there might be teenagers in the house, and I don't know about anyone watching this, but I certainly go to bed before my children, so there's never a good time to sort of have that conversation. And then the weekends are ram-packed, kind of, you know, driving everybody somewhere. And again, it's that thing of being able to put not only yourself first as the woman, but yourself, you know, you together as a couple, to put yourselves first, especially after all those years of, you know, caring for kids if you've had them. So I think there can be a slight disconnect, and it can be a really hard time to kind of have those conversations. So kind of combining those two in that support, like how do you start the conversation with perhaps somebody who might be you know, if your partner wasn't to know, you know, it could be quite a delicate subject to bring up.
So I think it's individualizing. No one strategy works for everybody. So I might say something here and it may not be applicable to everyone. But generally, let's say if I'm the man and if you're the partner and your partner is going through menopause transition, you feel that they're having difficulties, they're having symptoms, then for them, it's about asking. I note that you're having some problems, you're having some symptoms. Is there something I can help with? Or what do you think this may be due to? Or I've seen some program, or I've read about something that this could be due to hormones. Do you think this might be a problem? And I'm more than happy to support you if you need anything from me. That's just a sort of a baseline summary of what the conversation will look like. And vice versa, I guess, Kate, you'll be in a better position to advise how to kind of inform men about if you're having difficult symptom. But it's about, I think, very open talking, sort of getting to the agenda very openly, trying to say that, yes, I'm having difficult time. Do you know what menopause is? And sort of hormones change during this time, and I may be having XYZ symptoms. You may notice some changes in me. Should we have a quick chat about what I'm going through and what I'm planning to do to help myself? Something like that. And it may probably not happen in one go. It's probably going to be lots of physical cues, lots of conversations first, which may be indirect, to get you to that point where you have that finally open conversation. And the flow is both ways. There are difficulties both ways, for men to ask women and for women to ask men. But it does happen. I think both of you caring for each other, noting that there is some struggle happening, some symptoms are coming in, eventually the conversation will build up.
Yeah, no, I agree. And I think from that perspective, as a woman who kind of had to broach that topic, I think I do remember getting my diagnosis, and I think I was relieved that there was you know, a reason for my symptoms, but really afraid. And I've talked about this before, to kind of go, this is it, because when I was diagnosed, what was that, like almost 7 years ago or so, you know, the images of, I think that's the other thing, the images of women going through menopause were never very positive. So, you know, it was almost like we were sort of written off, that menopause meant, it didn't, you know, now you see these strong images of women, and there's a really different kind of outlook, I think, because we're changing that narrative. But I was really scared of telling my husband, because I was like, he's going to sort of switch me out maybe for, you know, a younger model. But it was great, because we sat down and we had the conversation. And I think, you know, it was sort of, how long is perimenopause was one of the questions. And I said, I don't know, because it's, you know, it's not linear, and it's individual with each person. And I kind of said, like, if you could give me maybe, you know, let's imagine it's 10 years. 10 years, and let's go through this and do this together. Because I think what's really important is that I know that on the other side of this, we have a life together. If there is a breakdown in your relationship, there might be other underlying things that you might want to address outside of that. But if menopause is, one of those things, have that conversation, because I know that there's lots of exciting things to come once, this life stage is navigated. And equally, by making those lifestyle choices and changes that I've done, I now feel like I am back to normal. But I also think it's really important to say that I'm back to normal, but I still have those fluctuations, because as you all know, it really isn't linear. And I think that that's the other thing that is really important to let men know, that whilst your partner might have got help and might be seeking help, the hormones, when you're going through that perimenopause roller coaster, they are still changing. So there will be tweaks that might need to be made. If you're settling into a regime, I know that for me, I was still having intermittent bleeding, and it wasn't until I got the coil fitted that that sort of worked. So it's letting them in and having those conversations. And actually also, for those of you that do have children, that are, I say old enough, I think at any age they're old enough. I mean, Rupert probably knows more about menopause than most men, and he's only 8, bless him. That to have the conversations with your kids as well, because I would like to think that, if we sort of come to that workplace mentality as well, that my son, if he's got a teacher that perhaps is having a terrible day and being mean, or gets a hot flush, or gets brain fog, that he can be empathetic with her, because he might understand that the person in front of him is having a symptom of menopause. And I think that that's where the education starts. But by allowing our children as well into that conversation, we can help our daughters hopefully avoid some of the things that we've gone through, but help our sons to be good partners, in the future, and to people around them. And I think that is kind of really really important to bring everybody in and have that conversation.
Absolutely, absolutely.
So I was going to say, in the workplace, because I know that lots of workplaces do have a menopause policy, and I know that people have been doing workplace pledges. I do have to slightly admit that I have been and got in touch with a few companies through friends and asked them to Google their menopause policies, and I don't know how robust they are. What would you say to anyone watching it who wants to put in a menopause policy, or what would be the steps, and what would be your key takeouts for someone to get into the workplace?
So I think having a policy just for the sake of it on paper never works. That's mainly a defensive sort of technique for organizations. What is important is really to build that culture. So what you want is that the organization clearly makes it evident for everybody working in that organization to say, I will be supported if I have a difficult menopause, if I have symptoms, if I have to change my work pattern, if I need help. That's really key. So making sure that you are having events, you're having menopause champions at workplace, and sometimes it may have to be different people. Say, for example, some women may not be comfortable opening such a conversation with a man, if it's a manager, for example. Some may have cultural sensitivities across different ethnicities. There may be requirement for very specialist, confidential space for people to open up. So as long as you're providing that, you're making people, getting them signposted to places within your organization where they will get this, not making sort of menopause a joke or fun thing at workplace. This is often a terrible thing to happen. Equally, not making it a problem, not making menopause seen as a problem, taking it very positively to say this is a change in your life. At a certain stage, this will happen. And we have things in place so that if you need flexible working, you need access to temperature, you need access to hydration, you need access to see somebody, see a medical person if you're really having difficult symptoms, we will provide you with all that support. We will make sure that we make reasonable adjustments if you need workplace adjustments, which are mutually beneficial for both of us. I think that message has to be clear on the front page. I don't mind if you have a policy on paper. but actually in the workplace, if you can demonstrate this to your employees, that is the culture we want to see. It is happening. A lot of companies have it, but as you said, it's not universal. There's a lot of work still that needs to be done. But having that sort of culturally sensitive and helpful organizational culture, that needs to build from scratch, from top to bottom. And we hopefully have to keep striving for that.
Yeah, and actually, I'm going to kind of like pick up on that and twofold and answer a question that has come in as well, because and there are a few, and we will come to those. But I think what I have seen, and I've gone into a lot of workplaces, as I say, I've seen their policies. I'm actually going up to a really big firm on Tuesday, which I'm really excited about, because they actually want to know how they can help their employees with lifestyle changes. And I know that someone has put here, it's been mentioned a couple of times that for smaller symptoms, these can be helped by lifestyle changes. What lifestyle changes specifically? So it's probably a good time to say, because I do feel like you go into the workplace and like you said, they've got the form and they've got what you can do, but how do we actually hold the hands of those people navigating menopause and say, we want to help you implement this, or we want to help you and support you doing this? Because obviously, as you and I both know, exercise, diet, rest, mindfulness, all of those things, it's a 360 approach. And often, you might have not a very nice kitchen at work. So you go out and you buy foods that aren't necessarily nourishing your body, or you've got such a high pressure job, you haven't had time to make food in the morning and things that you can take. You may not have time for exercise. You may not have time for movement. And so I think it's really important in the workplace that actually they look at that and they see what they can offer their employees to be able to have access to better nourishment, and to be able to say, look, we would like to have, every 2 hours, 15 minutes, you go out, you get some fresh air, you go out for a walk. Maybe somewhere on the wall, there's something like, don't forget to do your squats today, or, just getting that body moving and building that strength. And equally, making sure that they do have access to, to good, healthy foods, or a kitchen, because again, buying foods, it's really difficult, again, with women that I work with, slightly going off on one, but if they're not prepared, you'll then think, well, I'll go and buy a healthy snack from Prep, because you can, but often they're not eating properly, and we can come to that if people want to. So they go in and they're really hungry, and they buy all the things that aren't necessarily going to actually feed them well, and then they get lethargic in the afternoon because they've sort of got a big heavy meal, the sort of snacky meal that they're struggling to break down. They haven't managed to get their steps in, and then they go home and life is busy. So I think like little things like that in the workplace are really key, is allowing people and educating people, not just on what you can do in the workplace if you have a hot flush or take time off, but how should we be nourishing our bodies? How should we be moving our bodies? And in particular, perhaps helping people who, because again, I'm very honest about my story, I was drinking too much alcohol because I thought, oh, well, do you know what? I can't sleep, I'll have a drink. The pains, I'll have a drink. So actually, encouraging women to look at what their alcohol consumption might be. I know it's a really probably tough topic in the workplace. But again, little things like that can really help with sleep, can really help with some of the aches and pains that people are experiencing, because again, obviously, when that decline in estrogen happens, our inflammatory markers go up. And a lot of the things that we put into our body can control, our reactions to that. So again, I think support with, diet and nutrition can be really, really key in the workplace. And obviously, we know that some of those symptoms postmenopausally, cardiovascular disease, type 2 diabetes, osteoporosis, osteopenia. And if we want to look after our partners and our employees, employers, anyone, any woman navigating this life stage, helping them make those lifestyle choices will have a significant impact on them at home, and obviously in the workplace as well. Do you have anything to add to that?
Absolutely, Kate. Very, very vital. Lifestyle always underscores, whether even if you need a non-HRT, HRT medications for your symptoms, nothing is more important than lifestyle in the background. And as men or partners, you can support that too, because two people doing it together will actually be more successful. So if you're a partner and you may be at midlife, you may be having similar problems with weight gain, with diabetes, with maintaining good body fat. In all those situations, actually, both the partners can work together, find out the best time to exercise together, to eat healthy together, cook together. And that would really kind of reinforce one's progress to another, keep you motivated, because we all know in modern life these things are difficult. And so again, if you work together, this is another tip where partners can immensely help, because while you're going through all your day-to-day routine stresses of life and work, nothing like doing things together for your long-term health.
Yeah, and I was going to say to that, you touched on the weight gain again, obviously, which I know for many women is a really difficult thing that can happen as we go through menopause, and that really has a significant impact again on your confidence, not just at home but in the workplace. And so I think having those supportive conversations, like you've said, and understanding that this is a transitional phase. But they can, you can support your partner and you can help. And I think for I guess for like the men to know that are watching this, you often might be that your partner decides to try fasting or keto or juicing or low carb or low fat or another diet that might have worked in their 20s and their 30s. But actually, if you can try and encourage her to eat a really lovely wholesome breakfast or cook it, a lovely dinner with protein, fiber, good fats, all the things that sadly as women we have demonized. And I think those conversations are really critical and crucial to have, because it's often quite daunting when I work with them and I say you're not actually eating enough, and when you put on weight, it kind of seems counterproductive. But a lot of the time, the only way they might then be able to lose that weight or maintain weight is by adding better foods to their plate. And again, I'm going to say it because I have to, lifting weights. So encourage anyone around you to start, lifting weights. HIIT can be good and it is good. But again, it can have a massive impact on joint aches and pains, cortisol levels, which again can impact your sleep. So yeah, I guess sit down with your partner and, like you said, work out something that you can do together, because I think that that's quite an important thing. Just obviously, I have to say it because it's come up in my brain. It makes me laugh. It's like when for those of you that have had kids, and you had younger kids. I mean, you might not remember it, but you would have those sort of like Saturday morning, like it's my turn to exercise, or it's your turn to exercise. Whose turn? And I want to do it, because you both have to manage the kids. This is like that prime time, hopefully, when you've got more time together to actually embark on a journey of both of you eating well, of both of you working out, because yes, we're talking about women today, but obviously men's health is as important as your partner's health, because the last thing anybody wants in that relationship is for anyone to have an illness, and for them to be as equally strong and well as each other can be really, really helpful. I'm going to ask one more question and then I am going to come to the questions. How would you encourage someone here to be an advocate of menopause awareness? Like what can people do after today? A sort of a little ripple in a pond goes a long way. But how can we really make sure that this does have an impact at home and in the workplace for the people that have joined or are catching up? Obviously, they can share it, but what would be your top tip as a man to say to give someone the confidence to be that advocate?
Well, I think you will see it for yourself if you start doing it. So often the hesitation is, oh, I'm a man. What if I talk about menopause? People may not accept me. I will look like a fool. But actually, it doesn't happen. You'll be amazed if you start talking about menopause, if you see people who are struggling, having symptoms, having difficulties post-menopause, and you start talking about menopause, maybe signposting them to help, maybe offering support, it is very much appreciated. not just in your family, in your friends, but even at workplace. You will be the person who will be really applauded for taking this topic up and talking about it. So I think we have these hidden barriers in our mind that maybe if I do this, I will be ridiculed. I should not be talking about it. But when you start doing it, you realize that actually people are much more accepting. People appreciate that you've come out of your comfort zone, and being a man, though, you're still doing something actively to try and help and support your colleagues or friends or workplace colleagues or family members. So there's no one strategy, there's no one sort of pointer or tip here. Simply, whenever you see somebody and you think maybe they're going through a difficult time of life, difficulty with hormones, it's no harm asking them, do they need any help? Do they think this is something that's affecting them because of where they are in their life? And can you give them support? Absolutely fine. I think they will appreciate it.
Yeah. And so I would say, like anyone here who's got, sort of large businesses, set up menopause cafes as well in the workplace, and encourage people to join. And a man can set that up and hand that over to a woman. But again, I think, it's a shame to exclude them from the conversation. I know that women might share better amongst women, but if we do bring everybody in, it does make for a much better and easier transition for everybody all round. Now I don't know if we've got. I'm going to come because Kev, you've written something here, and I want to bring you in because it's great. So you said that your wife was having symptoms for at least 2 years before she realised her symptoms all put together could be perimenopause. It took another 2 years, unfortunately, before her GP would acknowledge it could be menopause related. Thankfully, then she got to an eventual point of appropriate medication and has since then pushed to understand more and love this and started an employee network group. I obviously wanted to do all I could to learn and support her. And when I joined the same business, I became an allyship lead for our menopause group. We encourage the narrative that menopause affects everyone. So all should know and understand it. For around 50% of the population directly, but for the rest indirectly, because everyone has family members and colleagues going through it. Kev, I love that. I might even bring you in to unmute. How have you been received by everybody? I'd love to know what the sort of men-woman ratio is.
Well, actually, I'd say, as Vikram says, at first it's a little bit daunting because you think imposter syndrome. Should I be here? Should I be talking about this? But because of the way I went through it in supporting Lou as she was going through that process, kind of following that same narrative of I'm here not to, I mentioned it in my next comment about in my first tip. You're not there to try and fix this. As a man, the first bit of information and the first thing that I would say to any man that's looking at this, it's not about you trying to fix it, and nobody is asking you for you to do that. What people want is for you to understand. And as Vikram says, to be able to signpost people. We've had comments from people that have said we have a menopause training package, that we have an employees package and a managers package, so that people can understand it both from us supporting their colleagues, but also as a manager supporting employees. And we've had people come to us that have said, I was talking to a friend of mine and she was talking about this, that, and the other, these symptoms that she was having. And I just said to her, and this is the male feedback. I said to her, have you thought about whether or not this could be menopause related? And then started a conversation around what he'd learned from his training. And that training gave him the confidence to have that conversation with a friend who then was like, I'm amazed that you even, this hadn't entered my head. And the fact that you knew this and was confident enough to have that conversation, that is the way it tends to be received, not who are you, why are you getting involved? Because it genuinely does affect everybody. So everybody does need to understand it. As you say, those symptoms that a person goes through, however they are, however easy or ever hard, for however long, if you're not there supporting and understanding, then that is a 50% of the challenge.
I love that. Thank you. I commend that. And it's really, that's like made my whole menopause month. To know that, you know, that there are places out there that have this incredible change. And I don't know about you, Kev, but I know that my husband is like actually secretly the one that everyone wants to sit next to when they go out for dinner, because they can ask him questions and he can kind of give you know, give that knowledge. And he does talk about menopause a lot. He's almost talks about it as much as I do. So I think that's brilliant. And thank you for sharing that. Keep doing amazing work. I've got one here as well. So my wife has started going through the perimenopause in her late 30s. Do I need to be worried about her longer health term prospects given how early she has started HRT?
Well, not in terms of HRT, but the perimenopause, yes, definitely. So as we were talking before, people can have menopause at different stages. So perimenopause can start very early in late 30s, and one can go through menopause at 35, 40, which would be premature. Could go through 40, 45 through the menopause, and that's early menopause. Certain ethnicities are more prone. So if you're Southeast Asian, then you would have average age 5 years earlier. If you're Afro-Caribbean origin, then again 1 or 2 years earlier menopause. So if you go through early or premature through the menopause, then that means you're having less hormones for 10, 15, 20 years of your life than you would naturally be destined to. And so in that case, replacing hormones is actually the best thing to do. So the premenopause, the premature menopause or early menopause can mean that the bones will be weaker, can increase the risk of osteopenia, osteoporosis, can have an impact on the heart and blood vessels, increase the bad cholesterol, increase the risk of heart attacks after 50, can have impact on cognition. Cognitive problems can happen after 50, can increase risk of diabetes, metabolic problems. All this is because the hormones have disappeared early on in life. So in that case, replacing hormones has very little risk because you're only replacing what's missing rather than giving somebody additional hormones. So you will be able to protect bones, protect heart, protect cognitive function, or avoid the risk of metabolic problems. And then come towards 50, then you can have another discussion with the health professional. You need to continue on the hormones. Are they having same benefits risk for you? And they will be able to guide you further from them. So no risk from HRT as such. Actually, not having HRT and going through early or premature perimenopause, menopause might actually have more of detrimental effect.
Thank you. So I was going to, sort of add obviously onto that as well, to say just as long as well she's obviously on her HRT regime, and that's there, that she is making those lifestyle choices again, which I know Vikram will support alongside the HRT, and again especially with that piece of you know, being in her late 30s, you know, protecting her bone health, you know, via lifting weights, via eating well, by moving her body will be really, really fundamental alongside HRT. I've got someone else said that they're also listening to this with their other half, and he said that learning about it and trying hard not to take things too personally are what he's needed the most. So I think that again is true, is understanding that it's not us withdrawing from you. So when we bite your heads off, you might not have done anything majorly wrong. It's just that the hormone sometimes can't you know, can't cope. And I think that's the other thing, isn't it? Sometimes if you know, if you are in a house, depending on again when you have had your children, but I know that I was going through perimenopause as my daughter was having her own kind of like hormone journey. And so it can be a really heated environment, you know, at home. And I think that, interestingly enough, that's where, again, these conversations are so important in the workplace, because actually, whilst there might not be a woman in your workplace that's affected by menopause, there may well be a man who has a woman at home and he doesn't know what to do. And then he comes to work and he is lost at work because he thinks that his wife's having a breakdown, or, you know, and I think that is the scale of what we're trying to crush, and what we're dealing with is as I say, like, it isn't just necessarily the woman that's going through this, but that it is that partnership, you know. And it can be really embarrassing because I'm not saying all men, but some men don't want to broach that topic. So, you know, if you're having a pint down the pub, you know, and you know you are having issues you know, you might not want to talk to your friends about it. But what I can say to men is, more than you know, anything else, talk to your friends, because actually they probably are waiting for you to say something. They probably want to say something. I think that's where women are really lucky, because often, you know, we'll talk and we'll go, oh my God, yeah, that me too, you know, that me too. And I always say that actually to my husband, just, you know, I bet all your friends are going through the same thing, just no one's talking about it, because men, sadly, you know, it's getting better, but haven't necessarily had those open conversations, you know, that women have had just by default. So I don't know if anyone has any other questions. I don't think so. I think everyone may want to scoot off on their Sunday evenings. But obviously, just to say, please, if you're watching this on catch up, if you're watching this and you didn't have a question, you didn't want to ask a question, reach out to me, reach out to Vikram. I'll forward anything I can, and we'll try and support you. Obviously, follow Vikram on all social media handles. If you need to make an appointment, you know, as I say, just follow us. Really good resources, actually, Vikram, as well, before we go. British Menopause Society.
Yes. So I think the BMS has loads of information. They have Women's Health Concern, which is their patient arm with lots of patient information leaflet. There are others like Menopause Research Education Fund, which I'm involved with, is a charity that's coming out with more information. International Menopause Society is yet another one. And there are many others. So when you Google, you'll come across some reliable, good website links with lots of primary care organizations, especially for healthcare professionals, as well as for the patients or their partners. Plenty there. Just need to go there, read it, and then that will get you the first step to helping your partner in this journey. And it's worthwhile. The moment you actually start getting involved, not only they, but you will have the satisfaction of helping somebody genuinely through a time which may be difficult for them.
Vikram, thank you so much for your time this evening, and thank you everyone for joining. Have lovely Sunday evenings, and see you all soon. Thank you, Vikram. Thank you.
Thank you.